Okay, once you're at that kind of the acute stage of lower back pain, one of the things we definitely can start working on is what we call lateral stability. So that's your body's ability to kind of resist sideways bending in your spine. So if you've got chronic lower back pain, it tends to flare up. Usually what you'll find that if you look at your lower back, you'll find one side will get kind of tighter than the other. So what we need to do is kind of fix that underlying issue, make your body a lot more stable around your lumbar in terms of lateral side bending, and you'll find that will give you a much more robust lower back health and you'll be less prone to flare-ups. So this is what we call a McGill side bridge level 1. Kind of a guy called Dr. Stuart McGill, who in my opinion is probably one of the best in the world in terms of dealing with chronic and acute lower back pain. So what we're going to do, we'll land on the side, got our knees bent, heels kind of close to our bum, not too close. This elbow needs to be kind of below the shoulder as close as you can, not too far forward, up, down or behind. And then if we look at the most important bit with this, at the moment if I stay in this position, my spine is bent laterally to the side. You can see it's kind of, bent sideways. With this exercise, the whole point of this exercise is to resist this. Okay, so we don't want to go back into this while we're doing this exercise. So what we do, hand across the shoulder here, we pull this shoulder back up, and if we bring these two shoulders as close to level as we can get them, we can see that from there, if I'm bent here, I pull this way, I'm now in a straight position, and that's what we're trying to teach with this exercise, is your body's ability to hold this position against kind of being pulled back down into it, okay? So from here, we come up like that, and then all I'm going to do from here is push my hips forward as far as I can, so I can, extend my hips as far forward as possible, and I just want to hold this for between 5 to 8 seconds per rep, and then from there, push my bum back again, trying to resist that side bend. Don't drop, try and hold it, and then come back up. Yeah? But what you're going to find in this position, you should feel your obliques and maybe QL around the back as you come in. You might also find that you're going to feel a little bit of side glute working as well. And what you're going to do is between 5 to 8 reps, for 5 to 8 second holds in each rep, and probably do about 3 or 4 sets per side. And what I would do is, if you're coming out of the first acute stage of lower back pain, I would do this exercise probably at least twice a day, every single day, and you'll find the better you get at that, resisting that lateral instability, the quicker your lower back's going to get, things are going to kind of ease off, I'm also going to be less prone to going backwards again as well. What you'll also find is that you'll have one side which is a lot easier to do this on than the other. Like for example, on your weaker side, you might feel more of a shoulder working, it's going to be really encouraging and hard, just find it generally hard to get your hips forward. That's a sign to you definitely want to work on that side, because those muscles here are so weak, your body's trying to use every muscle it can to kind of get into that position. What we want to do is really grind it out on that, really work hard on that weak side, and bring it up to the same level as the other side. You'll find your back a lot more stable. Generally speaking, as a rule, if you're right-handed, you'll find your right side's a lot stronger than your left. This is especially prevalent in anyone who plays one-handed sports, things like tennis. You'll find that right side, if you are right-handed, is a lot stronger than the left, and they can't quite get into position. Also, you might find when you first start, you can't actually get your hips all the way forward. Like, you'll be quite a bit off, and you'll find it really hard. But as you get stronger in these muscles here, your oblique and your QL get stronger on the side, you'll find you get your hips all the way forward a lot better. But again, just when you're doing it, make sure at no point you get lazy and just kind of collapse into this position. And so in from here, I come back on, and I'm holding that position the whole time. That's what I'm trying to teach these muscles here, to hold my back straight, okay? So whatever happens, make sure you're as straight as you can, you're not twisted, you don't let anything drop. So this is probably the most beneficial rehab or prehab exercise that I've found for chronic lower back pain. Because once you're kind of out of the danger zone, but in my opinion, if you have chronic lower back pain, this should be part of your warm-up for every exercise, especially if you're doing things like squats and deadlifts. This is really going to keep you injury-free.